does play a role in healthcare. And it's because of that, what seems like a simple question, would you take a COVID vaccine, does not have a simple answer. You don't need to go back very far to see why many in the Black community have a continued distrust of the federal government. Hurricane Katrina, the Flint water crisis. Minorities see those as monumental failures that hurt them badly. Dr. Tyler Perry, assistant professor of African American Studies at UNLV, says distrust is now very apparent during the COVID-19 crisis.
The history of American medicine has always been, one, racialized, but also two, classist.
The historical context of racial disparities in healthcare reveal a deeper narrative in which race, social class, and gender play a role in healthcare policy. But why? Dr. Perry says some argue the root of the current problem lies in the faulty promises of the past.
It was under the assumption that people of African descent couldn't feel pain in the same way that Europeans could, which reflects this idea of dehumanization and animalization to where a person of African descent was not as much of a human being as a person of European descent was.
Dr. Marion Sims from South Carolina, who's considered the father of gynecology, but part of the reason he had his success was because he was doing operations on African American women who were slaves with no anesthesia, because he assumed that these women didn't experience pain.
Dr. Melva Thompson Robinson, professor at UNLV, says Sims was long considered a medical hero, despite procedures we would now consider inhumane. And only recently did New York City remove his statue from Central Park. In what's become known as the Tuskegee experiment, Black men were treated as little more than lab rats during a study on syphilis.
Most people have some understanding of the Tuskegee experiments, where Black people in the South in particular were promised that they were being treated for syphilis, but it was really just doctors or scientists who were studying the effects of syphilis upon the body and using essentially the Black body as a tool, not viewing them as a person, but something to experiment upon.
Treatment like that is not forgotten quickly.
There is a deep-seated reason for people of African descent in this country to distrust the medical community, particularly if they're offering them something for free.
Even for Native Americans, just how they were moved onto tribal lands, and the treaties and things that they have with the American government, and how those aren't being honored, and to a point they were taken advantage of.
Bias and racism only compound the problem, taking us right up to this day and this pandemic.
Don't be afraid of it. You're going to beat it. We have the best medical equipment, we have the best medicines, all developed recently.
As the death toll surpasses 200,000 Americans and cases still remain at high levels across the country, the coronavirus crisis is now one of the worst pandemics in U.S. history. The virus has disproportionately affected African American, Native American, and Latin communities.
It's showing up very strongly in our data on the African American community, and we're doing everything in our power to address this challenge. It's a tremendous challenge.
The pandemic impact has also exposed long-standing inequities in American healthcare. Experts say poor housing conditions, working in essential fields, inconsistent access to healthcare, chronic health conditions, and a weak immunity system all play a role.
COVID has not only killed people of color at disproportionate rates, but it's also completely upended their lives. And so you're dealing with populations and people who have basically lost everything.
I believe it will be when and not if we get favorable candidates with good results. We will be able to make them available to the American public.
As the pandemic rages on, the promise of a vaccine continues to dangle before us. Numerous trials are now underway as companies compete to come up with a cure for COVID-19. But in order for the trials to be successful, they need volunteers. Black people and Latinos have now become the target participants in clinical trials for coronavirus vaccines.
We need not only African Americans, but other people of color to participate in these clinical trials so that we know how these vaccines work in these populations.
Doctors argue the vaccines and medicines can work differently in racial and ethnic groups. Some are not convinced that is true.
One thing I suspect that's going on within the governmental apparatus is they are banking on the reality that they are going to use people who feel like they have no other place to turn to,
Leading some back to that well-worn sense of distrust.
For me, all of this is just in the history books in 40 years, this will be one of the events in a long line of the reasons as to why Black people distrust the medical community.
So how will America make peace with its past? Steps towards economic equality and vulnerable communities is a start. Instituting fair housing policies, implementing affordable health care, and providing access to education could also help. But representation in the medical field matters too.
So many people go to doctors and other healthcare professionals, and they don't see people who look like them. They don't see an African American doctor or an African American nurse or a Latino doctor or a Native American doctor. It's, primarily whites. And so, if you already come from a community where you don't have that trust, and now you're not seeing anybody who looks like them, then, you can kind of understand why people don't have a trust.
Building trust in the minority community won't be easy, but the first step is joining the conversation. Alicia Patillo, 13 Action News.